Deidre Griffith. Oh, can't hear you, but I know that you're here. All right. Um, Colleen McNicholas. And I can see that she's on. I know that she's traveling. Melissa Tapey.
Here.
Dr. Melissa Tapey. My apologies. Let me see. Dr. Imbal Shockham.
Here, thanks.
Elizabeth Ebert.
Here.
Dr. Barbara Ludy. Dr. Morgan Shields. Brittany Jones.
Present.
And Dr. Christopher Daly.
Present.
All right. With calling roll call, we have established quorum for the day, so we can move on to the next agenda item, which would be to approve the January 2026 meeting minutes. And to be a little more accurate, that date is January 15th, 2026 meeting minutes. Is there a motion to approve those meeting minutes?
So moved.
Is there a second?
Second.
All right. It has been moved and seconded to approve the January 15th, 2026 meeting minutes. Is there any discussion? Okay, all those in favor, please say aye.
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 All those opposed, please say no. Okay, the motion carries and the January 15th, 2026 meeting minutes are approved. And with that being said, I believe the next agenda item will segue over to Brittany Jones, Vice Chair, to do board committee updates.
Okay, thank you, Kristen. Good morning, everyone. Now we'll get a chance to hear updates from each board committee. We can start with the Community Engagement Committee, and I can provide updates, and then I'll open it up to our broader committee members. So for the month of February, the Community Engagement Committee had a rather robust meeting. We discussed a few things regarding the Department of Health, expanding partnership and outreach activities, and we also discussed the seasonal needs within our community. We were able to invite Shantae from the Department of Health to join our call, and she shared the 2026 goals and priorities as it pertains to community outreach and communication strategies for the department. Shantae her and her team created a very comprehensive plan, which highlighted their monthly engagements and themes, which intentionally also align their services, education and outreach efforts to ensure that there's a coordinated messaging strategy for the community, city residents, and beyond. And from this conversation, Shantae also had the wonderful idea to further efforts in partnership with community health centers to deepen awareness and education for city residents, but also deepen and strengthen the partnership with our health centers. And so a few folks on the board within that committee has offered to help coordinate the efforts and communication with the health centers. We also were able to brainstorm additional ways to expand public health outreach through collaborating with local nonprofit organizations whom the board is in relationship with. The city has also updated their brochures, so really trying to think about how do we make sure the updated brochures are in the hands of the nonprofit organizations so they themselves and residents within the city are up to date on the various services offered by the department. We also discussed the community needs, specifically during the winter months. We wanted to focus on this because this is also during the time where the city begins to slow down their outreach efforts. And so we were brainstorming different ways to continue to uplift the services that the department has to offer. So we realized that during this time there tends to be an increase in coat and food drives. So what would it look like for the city to have presence and or have their brochures there for additional service delivery during these months in particular? Now I will go ahead and open up the floor to any of our other Community Engagement Committee members who would like to add. And also, I would like to invite Shantae, if you have additional information that you would like to add that I might have missed.
Morning. I think you covered everything great. The only thing that I would like to add is that we are currently preparing for this upcoming outreach season out in the community. So we're getting our incentives together. As I stated, we have a plan already in place, but this is the time we're going to start participating with our community partners in outreach events out in the community. That starts beginning in March. And will carry on until November. So we're looking forward to highlighting those outcomes with you all at a later date. That's it.
Thank you, Shantae. Any other remarks from committee members within the Community Engagement Committee? Alrighty, hearing none. Now I will turn it over to Dr. Inbal Shakam, Chair of Academic Partnership Committee for updates.
Thanks, Brittany. We had a good meeting, everybody. If I speak or miss something, please let me know if you were at the committee meeting. I will tell you that we focused our conversation in our meeting about our public health showcase, our public health internship showcase. And so we are planning an event in October to highlight the internships that have been conducted and highlight opportunities for internships in October for the next semester. So we are collecting volunteers who want to help us lift this event. We are planning it thanks to Deidre. We're going to plan it at Del Mar Divine, and thanks to the commissioner, she's going to fund some of this effort. I think it should be a good day. The date is not confirmed yet, but we will hope to have that very soon. I think that's it for us. Thank you. And please share. Craig was there. The commissioner was there. Thank you.
Thank you, Inbal. That's wonderful news. We're looking forward to hearing more about it.
I would just add, it's very promising with the dates we were looking at for availability at the Del Mar Divine. So I will follow up with the group.
Perfect. Well, thank you, Academic Partnership Committee. Now I would turn it over to April Miggins-Jolly, Chair of Governance Committee for updates.
Thank you so much. I'm sorry that I'm not able to be on camera at this moment. Governance recently met to establish what our course of business is going to be focused on in this year. And we established kind of three main areas that we're going to be focused on. And of course, we welcome feedback from the rest of the board. But those three areas are board composition and filling vacancies, or at this time, the one vacancy that we have. The second area was around the question, or maybe the unanswered questions around modernizing the charter. So while we have spoken at length and recognize that it is very challenging to update the charter, we did talk about the fact that it would be helpful for policy makers to know exactly what areas of the charter regarding health would need to be modernized should they take that up. And so Chris is actually going to be leading the effort to look at that language and make some recommendations on ways to update it and bring it in line with the way that we currently operate. And Vice Chair Brittany, we will be asking you to join us for a future meeting to talk about how to perhaps engage the Board of Aldermen or other folks around why we would even want to make changes. The third area that we focused on was around training and onboarding. So as everyone knows, we did updates to our bylaws at the end of 2025. And one of the areas that was strengthened under governance was that it clearly spelled out that we have a role in training and onboarding new members of this board. And so we're going to be heavily focused on a system of knowledge and tools that'll just make it easier for folks to understand what is public health if you're not quite sure, and what does our city do when it comes to public health, and how does our city collaborate with others. And so you will be hearing more about that. And in fact, there will very likely be a survey with a question asking about knowledge gaps that either you as a board member have or that you've maybe seen in others, in ways that it would just be easier for folks to join the board and feel like they can quickly jump into this board's work. Another part of that training piece is, of course, the Sunshine Law training. So you all should have gotten a hold on your calendars for March 5th, waiting for the city councilor's office to send a Zoom link. But I will be following up to ask how folks who are not able to join that session can make it up. And so when I find out what that process is, I will share it with the rest of the board. And I believe that is it for my summary, but I certainly welcome other members of governance to chime in if there was something that I might have missed. I'm not hearing any, so I guess I did a pretty decent job.
Mhm.
Thanks.
Thank you so much, April. Thank you, Governance Committee. Now, next on our agenda is the update on the quarterly joint committee, so I will provide updates for that. We held our first joint committee on January 13th, and in that meeting, we discussed a shared vision for this committee and brainstorm various public health priorities that we see as a priority and would like to assist the department in advancing. This space in particular is different from the committee spaces because it is a space for us to be able to share and workshop through conversations that happen in our respective committees. So, for example, today you heard about the wonderful event that the Academic Partnership Committee is planning to put on. That is something that we can talk about within the joint committee space and flesh further out and see if there's room for any cross collaboration there. This space also allows opportunity for the board to deepen impact and our commitment to advancing the mission and vision of the Department of Health. Each board member during our January 13th meeting was able to share 2 public health priorities that we believe that we can support the department in which we will share soon. We are in the process of reviewing themes and action steps from the priorities shared. The next committee meeting will be held on April 14th. And we'll provide updates during our April meeting. Lastly, for this section, I will provide some updates and reminders on advocacy efforts. At our last board meeting, we talked about the Missouri Public Health Institute, MOPHI, has opportunities for individuals to be involved in public health advocacy across the state. If you are interested in being involved, you can contact Kelly McGowan. She is a policy and membership engagement manager. And there are 2 additional opportunities for in-person advocacy at a state level. January 29th, there's a Missouri Legislature 101. And March 10th, the Missouri Center for Public Health Excellence is participating in Capitol Day. So those are ways for folks to be able to get involved and really advocate on behalf of the City Department of Health. And now, Kristen, I will give the floor back to you so you can close us out of this segment of the agenda.
Thank you so much, Brittany, and other board members for sharing. I'm excited. All of this is really exciting as we think about the public health landscape of our region. Obviously, there's a lot happening at the city level, and so much to discuss in terms of how we ensure that our city residents and beyond are handled with care, and that public health remains to have a space in place. To move on, we'll go ahead and switch over to health department updates. That I will turn it over to Commissioner Anwari to lead that section.
Good morning, everyone.
Good morning.
I'm going to share my screen really quick. So you had asked me to provide an update on where we are with influenza, and I will do that really briefly. Can you all see my screen? It should be a graphic and a table.
Yeah.
Okay, so where we are with the flu season now at this point of the year, we're in week 5 of the year, and we are seeing 156 cases from the CDC data. If you look at the 5-year mean, the 5-year mean is 178. So we're below the 5-year mean. And if you look at last year, right here, we were at 633. So we're well below last year's numbers. And so while we saw that spike in week 52, right here, we are back down to below the 5-year mean. So in terms of case counts, in terms of hospitalizations, it's showing the same trend. We are slightly above the 5-year mean at around and so the week ending 5 at 5, we were 1.75% cases in the ED, average cases in the ED. So that's the update. Does anyone have any questions?
I do. Thank you for that update. I am curious if you all have seen just like an uptick in, I don't know if you all monitor strep as well as you do for the upper respiratory infections. And I know that I've seen a surge personally just in the region, particularly in school-age children. And I didn't know if you all had updates for that, just thinking about our vulnerable population, so our children and our seniors that may need to be aware of precautions as it relates to those facts.
To strep?
Or yeah, I think there's also like, I don't know, I just know my kids' school, like half the school is out, the early childhood center is out. And so I know while the metrics say it's, not at the surge level, the reporting across the region just by people that I know have been deeply impacted. And so I just wanted to know if there was any other discussion around, or advisory of safety precautions for our vulnerable populations during this season.
Sure, absolutely. So we sent letters to the schools around influenza. We do that every year. And so we haven't seen any specific reports of spikes in strep, but we can certainly look at that data and determine if we need to do specific outreach to local schools.
Okay, awesome. Thank you. My only other question, I have seen recently that the city has been posting precautions around measles outbreaks. and just any updates that you all have around that. As we understood, I think it kind of started around Kansas City, and then there was a recent report of it being closer to the region. So just any updates around that.
So we've been involved in partnership with the state, with the county, with the Illinois Department of Public Health, in putting out information about the most recent measles exposure case that was from an individual traveling from Fort Lauderdale, Florida, through the St. Louis airport, and then using parking spot shuttle here to drive home to Illinois. So the jurisdiction it's an Illinois case, but we've been in partnership with, as I mentioned, the Department of Health and Missouri Senior Services, as well as the county, to put out a media release regarding this, regarding exposure and what individuals need to do if they think they have been exposed. If people have been exposed, the most important thing is to isolate themselves and contact physicians contact their physician before visiting the hospital, so that precautions can be made, so that others are not infected. Again, the most preventative tool that we have for measles is the vaccine. So it's recommended that kids are vaccinated with the 2 doses during their childhood. That vaccination, once it occurs, provides protection against measles at 97%. The most vulnerable, obviously, are those who are not vaccinated, and then as well as pregnant women and our older adults and people with immunocompromised conditions.
Thank you so much for that amazing update. I don't have any further questions. Does anyone else from the board have questions before we move along in the agenda?
Yes, I have a question. Thank you for sharing that you share alerts with schools. Is that all schools in the city, including public, private, charter, etc.? And do you need help making contact with any schools that are not public?
It is all schools. Shantae, correct me if I'm wrong. I believe we have a contact list for all schools in the region, including parochial, private, public, that we have shared the information with.
Thank you.
Yes, that's correct.
Okay. Any other questions? All right. Thank you again so much, Commissioner Anwari. Moving on to the next agenda item, which is our childship overview from Kat Pittman. It's so exciting to have you. We have board members that are newer and very much interested in having a deeper understanding of this community health assessment and collaboration, this regional effort, I guess I should say, between the city and county. It is one of the things that we find we're most curious about, as well as something we'd love to see more collaboration with as it relates to public health across our region. So
Thank you,
take it away.
Kristen. Can I introduce Kat? She's a new
Oh, sure.
member.
Yeah, that's your team. Yes, you should.
Kat Pittman is our new health marketing administrator, and is that right? Or government? No, health marketing administrator. Working closely with our CHIP and our CHA. We're so excited to have her here. And Kat, if you could just, before you start your presentation, tell everyone a little about yourself.
Sure. Hi, everyone. Happy to be here. Thanks for the invite. So I just joined the team in August. I am a military transplant. My husband and I moved here from Nebraska, and I've just always been involved in community health. I worked at a nonprofit in Omaha before I came to the health department and worked with the senior population, which I really enjoyed. And yeah, I'm here excited to be involved in the Community Health Improvement Plan. Okay, would you like me to get started? Okay, can everybody hear me okay? Awesome. All right, I'm going to share my screen. Okay, can everybody see the presentation? Okay, great. I'll get started here. The commissioner asked me just to go through some updates on what our teams have been up to, and then I'll chat about the CHA CHIP collaboration towards the end. So just a reminder, here's the CHIP priorities, which we all know about. And I'll start with the intersection of health and economic mobility. Our co-leads, Julie Gary and Christopher Nolan, they have been really just trying to get, I'll just sum this up, trying to get the right people at the table that can move the needle on this work that the team is doing. They have not had very much momentum this past year, but we are working together right now just to establish a regular meeting cadence and working with the leads to engage the right stakeholders. So that is what's going on with that team. The next, our chronic disease action team, we have Rochelle Bartnick and Lauren Landfried on this team. The big thing that was created was their 10-year strategic plan. That was one of their goals on their action plan. The following areas are the ones that are most emphasized in that plan, which is more coordinated, unified, systemic nutrition security solutions, increased participation in food assistance programs. They are prioritizing food and nutrition in healthcare for prevention and management of chronic disease. And then they are looking into hunger relief, food pantries, food banks, food assistance programs, making those more valued points. And then reducing the food desert footprint. So it's a very robust strategic plan. And they have created a partner collaboration kind of group worksheet where everybody is going in and putting ideas and different things like that to help move this forward. All right, so I'll move on to, if anybody has any questions or if any of the CHIP leadership that's on this call sees that I'm missing something, please just jump in. Maternal child health, the co-leads Dr. Elizabeth Daniels and Rose Anderson Rice are on this team. They have been pretty busy. In support of their objective 1.1.2 from their action plan, that is increased clinic visits for pregnant women utilizing CHWs, peer support doulas, and patient navigators. They facilitated a prenatal listening session. They had 11 moms come to this session. They were able to capture a lot of lived experience data, and they did identify several barriers, specifically around transportation, insufficient provider face time, and language barriers. That was a very successful session for them. And then the Community Hope is launching an app called Epic, Emergency Portal for Infant Care. It's for teen moms. This will come out March 16th, and they can get on there and request things such as formula, diapers, counseling, childcare, and more. Very exciting app there. And then one area that needs some work, especially in just getting more people involved, is the policy and advocacy subgroup they have and their health education and literacy subgroup. The existing work that's being done in those groups really just needs some more promotion. So that's one thing that we're going to kind of help work towards to get those groups moving forward in the work. One of the things they did bring up in this policy and advocacy subgroup was that there was a doula bill regarding doula Medicaid reimbursement that apparently passed out of committee, but it's kind of stalling. And so I guess the trend is that a lot of the doula bills, they get passed and then they usually stall, so they don't get on the floor. So any advice on how to get that work moving forward, please let us know. All right, I will move on to violence prevention here. They've done a lot of work, a lot of reporting we received from them this past quarter, which was good. 182 schools are now using the Handle with Care trauma-informed system. There's 2,372 high-risk youth have used the drop-in centers and safe spaces. And then they are currently working on developing guidance and best practices for youth serving organizations. Very exciting stuff happening in our violence prevention group. Moving on to behavioral health here. Colleagues Bill Winfrey and Katie Weigel, they created a mental health training directory. And one of the goals, this supports their goal 3 to increase the availability and accessibility of behavioral health services. And they are going to hopefully use it. It'll act as an online database with updated mental health training information. So right now, brainstorming ideas of where this is going to live and how we can track engagement to the site. They have had 856 referrals that were made to transition clients to behavioral health services or primary care services in the community. And moving on. Okay, so that's all the updates for the action teams. If anybody has any questions, I can answer now, or I can just keep going on. We just have the mini grant update, and then I'll talk about the CHA chip.
I do have a question, Kat.
Yeah.
This is really great information, and I also serve on the chronic disease action team, so it's been nice to be able to see how the work group is moving along. What, if anything, is implemented to make sure that there's coordination between the various committees? The chronic disease one has created the 10-year strategic plan. Is that an expectation for all of the committee groups?
That is not. That is just one that was part of their action plan, one of their goals they wanted to create. So not every group is doing the 10-year robust plan. Yeah.
Okay. Is there anything to kind of make sure that there's some form of unison or coordination between the groups and maybe structure or?
As far as working all towards that plan, like everybody kind of contributing from all the different teams?
I'm just thinking about the
Yeah.
design, like the expectations of what will be carried out, outcomes, measuring of impact. If there's any
Oh,
coordination between those?
yes. So they are measuring, yes, they are tracking and measuring impact. We do not have, right now, currently, we do not have their numbers, their data, but Rochelle and Lauren are keeping track of that. That is one thing that we are trying to be more on top of to get that data from them. But yes, they are tracking
Okay, thank you.
outcomes. Yeah.
Hey, Kat.
Chris,
It's
hi. Hey, Craig.
Craig. I just wanted to point out you guys have that quarterly meeting where all the leads come together and they do share and they do some of that cross-pollination that you're talking about.
That is correct. We do have those meetings. Yes. Thank you, Craig. And then Kristen and Melissa. Oh, Kristen, sorry. I don't know who was first.
It was Dr. Tapey. I can go after her.
Dr. Tapey.
Thanks. Good morning and nice to meet you. I appreciate the strategic plan for nutrition, and I am sure it's on their radar, but just also to mention to be aware of the populations that will be rolling on and off those benefits, right? Because of Medicaid, because of state changes to benefit plans coming from the federal government. So who is in crisis may not always be exactly the same, and just to be aware of that so the intentions can be focused. Also, if perhaps we could get into an email afterwards. I'd like to offer that Affinia has a midwife that particularly focuses on grief care for pregnant and peripartum women. And that is open to any patients, not just community patients. And unfortunately, that is a care line that has been valued by many of our patients. So I'd like to connect that. And then 3 of our leaders at Affinia that really do a lot of the community maternal child work. I'd love to connect with you for the policy and advocacy and that health literacy, because they'll have a lot of in-community experience to also help share and coordinate.
Wonderful. Thank you so much for that. I will definitely connect with you offline.
Okay.
I appreciate it.
Thank you.
Kat, I would also love to get my infant and maternal health team connected with you related to the policy and advocacy. We're actually meeting with our government relations team next week to deep dive on that and some of our other strategies. But if they could, I don't think they are on that committee, but if we could connect as well, that would be great.
For sure. Thank you.
Thanks.
I was going to I echo Dr. Tapey. I was sitting on the maternal child health committee, and my email changed several times. Kat, I know I've sent you some reports and all the things. I agree. There's a lot of room and space in the work that I do across the region in terms of health education and advocacy. So would love to involve myself. I can also talk to Rose and Dr. Daniels as well, but any input that you need from us, happy to show up in that way.
Thank you so much, Kristen. I appreciate that. Thank you.
Oh, and Brittany, I know you mentioned like strategic plans, and I know it's hard because we're not all on the same committee. I do know that maternal child health has a pretty comprehensive plan. I think it goes out to 5 or 6 different main stages with a lot of subgroups of focus that are all directed toward, trying to improve maternal child health in the region. Part of it's education, part of it's policy bill movement, part of it is resource allocation and making sure people have those things. And so, yeah, just wanted to share that there are strategic plans, not a 10-year, but there are strategic plans. I'm not sure of the other committees, but I imagine and hopeful that they all kind of operate similarly.
Yes, they do. They all have plans in place. Yeah, each group has an action plan in place. Each group has meetings that are held. But the chronic disease specifically just kind of pulled out a 10-year strategic plan that they're working on. So it's like embedded in their actual overall plan. So, all right, sorry to confuse everybody. I'll just go really quick over the mini grant update. Commissioner Enwari asked me to just let you all know what some of the teams that have ideas for what they're going to use mini grant funds on. We did, I think you're all familiar with this, but we received LPHA accreditation funds, 74,000, and we have partnered with Mental Health Board. They're our fiduciary agent, meeting, and they're continually right now meeting with the teams to discuss how that funding is going to be used. And so each team's getting about $15,000 to use towards something that's part of their CHIP action plan. So something in there. The MCH team has come up with a doula Medicaid billing assistance service. Not sure what that looks like or what that would look like. That was an idea. And then they are really interested in having and hosting some teen mother community events. So hoping to use the money towards one or both of those. The behavioral health team, they are really interested they've developed this mental health training directory now, and they're interested in using the funds towards upkeep. So keeping it updated and then possibly having it being housed on a website, maybe in partnership with another organization's website. So looking into how we can use funds towards that. And then IHIM would like their funds to go to SLATE. So those are just the 3 that we know of right now that have come up with ideas for funding. And I will continue here. The CHA-CHIP collaboration. Very excited about this collaboration. We do have a very big goal. We would hoping to work towards one combined health assessment and to get on the same cycle. So right now, hospitals are on a 3-year cycle and we're on a 5-year. So we are hoping to line up with the hospitals and have that one combined assessment and get on that cycle. So we've started meeting with hospitals. We've solidified a meeting cadence, and we are working with the key stakeholders that are kind of involved in this process, hospitals and city, county health departments. And we have started or we have scheduled MAP 2.0 training. So this is going to be our common framework that we're going to use to go about this collaboration. So really exciting stuff. We're still working out the details of everything, budget needs, resources. But we have definitely started, like I said, meeting regularly, and we are going to continue to move this work forward. All right. Anybody have any questions for me?
Yeah,
Regarding-
I have a quick question on that. First of all,
Yes.
it's extremely exciting. I think my colleague Christopher Nolan told me you'll have a
Yeah.
great kind of kickoff meeting. I assume you were there at the Del Mar Divine to discuss this. I know that just naturally we're going to be on the same cycle next time. So then the question is, what happens after that? Or are we feeling like, somebody, hospitals or
Right.
health department. I know it won't be hospitals because we can't, we'll be able to just stay on that 3 year. But it may have not been figured out, but I just wanted to raise that up, that we will naturally be on the same cycle next time. But
Yes, that's the goal. The goal is to be on the same cycle and using just one assessment. So that's kind of what we're working towards. Yep. However that looks, right? We're trying to still work out the details. Yep.
okay. Yeah.
Deidre, is your question more about the future? So like after this?
It is more about the future, but to Kat's point, I mean, it is, the goal is just like whatever it takes for health departments. And that's surely a longer, deeper conversation that I know nothing about, because I don't know what it takes to change your cycle from 5 year to 3 year.
Yeah, so can I just comment? This is, and Deidre, this has been a goal for the city and the county to be on the same cycle since as long before I even got here into the Department of Health. And it's finally at this stage where our cycle is the same as the hospitals. So the goal going forward is to have a coordinated and collaborated health community health needs assessment. I believe Rhonda's not on, but last time I spoke with Rhonda, I believe there has been a potential change in us being able to do it every 3 years instead of 5 to be on the same cycle. So this is a big win for us. I know that your colleague at SSM was last year had to do, I think, 15 different CHAs because of all the hospitals. So this is really a big win for the region. And I know you've been involved in in the conversations going forward.
Yeah. No, it's super exciting. And like you said, it's I mean, when I went to SSM and got involved in 2019, like you said, it's been a goal for our region, for so long. And so many people have had a hand in keeping it going. So it's exciting to see it finally get to a place of, that coming to fruition. I see other hands, so I'm going to shut up.
Yeah, jump in, whoever is next.
Dr. Shacklin, did you want to go?
Sorry, thanks. I couldn't find the mute. Thank you. This is awesome. As a transplant of 20 years, I particularly am so excited about this movement. I think the work of collecting and organizing together is hard and really impressive. I can't remember who asked, I apologize. Is there a way? Sorry, and this might be my problem of not knowing how this works. So is there a small committee of people who are ultimately responsible for the collaboration? And are they able to, and if so, are they able to drive the overall measures of collective measures? Because each of these areas are important, and collectively, there should be one plan in my mind.
Yes. So the framework that we will be following definitely has the key players that are kind of leading the movement, right? And so we are right now kind of establishing that and trying to figure out what that looks like, and just trying to get the right people at the table. I don't know if that answered your question. Again, I don't have all of the details, We're going to be having that training at the end of March, hospitals and health departments. So we'll be able to know kind of more what that looks like, just to get everybody on the same page.
Thanks, Kat. I also mean like be on the same page. Actually, everyone's working towards the same goal.
Yes, we are all working towards the same goal. Yes, one assessment. Does that make sense? Am I okay? Am I going in circles?
One assessment,
Okay.
sure, but one goal, as in like all the activities are going to be aligned with that goal. So every one of these areas should be addressing the bigger overall goal of improving health in the region.
Yes, the priority areas, right? Of focus.
No, overall health.
Overall health.
Period. And so
Okay.
those priority areas should be rolled up to the overall health of the region.
Yes, that is correct. We're all working towards the same goal. Is that what you mean?
Sure.
Okay.
I just want to see a plan. I like one plan that
We do
has
not
all
have,
of that
yeah.
written. That would be
Yeah,
awesome.
that's
next.
exactly. I think that's what we're planning for sure. We would love to have that. But it's not planned out just yet. Sorry, there are more hands. Deidre, Kristen, go ahead.
I'll go next. Yeah, I had a couple questions. One, I know that you're still planning, so if you're not at this stage, totally understandable. But I'm curious, there's a lot of expertise on the Board of Health, and curious if there's a space in this in terms of advisory leadership. When stakeholder meetings are taking place, is there room for, a representative or two from the board to be able to be present in those spaces, to just because of connection? And I think leading into that, one thought that I had coincided with what Commissioner Nwari had put into the chat about, closure of FQHCs, which is a huge component of the public health across the city. And so curious, while it's great to partner with hospitals and health departments, I am hopeful that FQHCs are included as stakeholders in that conversation, as people who increase access to care for the city residents and beyond. So alongside with Dr. Shackelman, the point of ensuring that there is improvement of health, there's like a plan, a collective plan where everyone gets to buy into their expertise. As an institution that offers delivery, how do we have synergy across those efforts and not compete with those particular priorities, but really, especially because funding is funny, but how do we uplift those narratives to ensure that whatever that goal is, that the vision and goal is very explicit and clear in terms of ensuring that each component of these stakeholder collaborations that we're using at the best of our ability with resource and expertise to improve health outcomes regionally, right? And so I know I said a whole lot, but those were just the things that I'm thinking, so summary, is there room for board members to join stakeholder meetings? There's a lot of expertise there. And are the FQHCs included, particularly as we think about the temporary closure of Care STL in the moment and how that impacts certain residents and impacts access to
Oh,
see?
I'll take this one, Kat. Thanks, Kristen. So as several board members are already on our action teams, and so that's where they need to continue to plug in. So Kat can send out the list of action teams, and board members can plug in, and that's the most appropriate way for you all to plug in to this work. We do have FQHC representation on some of the action teams. Again, so we're not doing this in a vacuum, and we are trying to be as collaborative as possible. Well, I say that even while we're getting to have this regional community health assessment plan, each of our institutions are still individual institutions. So we want to be as collaborative as we can in working toward the same goal. However, this plan and the Department of Health cannot dictate exactly what BJC does in terms of their outreach. But the intent is to be aligned as much as possible in this work.
Yeah, I don't know if I can add much to what Victoria just shared, which is echo that. And for instance, Kristen, I'm not on there. My colleague is on there, Christopher Nolan. So he gives me updates so I know, how things are progressing in the committee. Also, you all may remember I mentioned the proposal that letter of interest we put forward to Missouri Foundation for Health. FQHCs were part of that big vision, as Victoria noted. So we definitely want them at the table. And when we do accomplish this, they have to be also United Way, because they do a community needs assessment. So them being part of it would also be invaluable. So that's the big vision. And I think now, knowing there's so many parts and pieces and hands in this, we will have to be intentional about how we stay informed as a board and not get snippets of bits and pieces here and there. So maybe we can work towards that. I was just actually originally going to add, like, for example, the mini grants. As to not reinvent the wheel and understanding we have an infant maternal health priority too. I mean, that's another area of opportunity to have organizations like create, and as I said, I'm not going to want to speak for them, but I've heard them mention they'd be interested in this as well, is to put in towards a pot, right? Contribute to this fund where we are all able to know that our priority around infant maternal health is moving forward. Anyway, so it's so much to flesh out, but this is exciting. It's in the end, it's very exciting because we're going to get there. We've never been this close before.
It really is exciting. And just to clarify, I'm fully aware of board representation on action teams, and I think my question is different. Action teams is one component, and I guess I'm asking more so of seeing FQHCs as stakeholders, which to me is a different layer of thinking about access to care, since they're a specific institution across our region that provides those services. So Dr. Tapie is about to ask questions, and so maybe my thought process of how I think about inclusion and who should be at the table in terms of supporting city residents through public health. Action team is one conversation, and I think stakeholder is another. But I digress. And Dr. Tapie, you can talk because you work at one.
I just wanted to mention that, I work at one, right? I believe FQHCs are a vital component of our community and the care that happens. And I do appreciate that over the years, especially over the last, I would say 5 to 6 years since COVID, in my leadership role, I have seen more interaction between the FQHCs and the city public health department than before. And it was very intentional. And I would just love to see that continue. We do take care of very vulnerable city residents, and in general, any city resident, regardless of ability to pay or wherever they're coming from. And, we really focus on primary care and trying to meet the patient where they are in the community. So I think we do have a vital stake. I want to respect what is happening at CareSTL. I think we should all keep our eye on that situation. I think it is fluid. I'm not sure where, I don't think we all know the kind of the outcome here yet. And they are a vital, they play a vital role in our community. So if and when they reach out, support, I'm sure, would be helpful. And I am always happy to, between myself, the other FQHCs, the IHN, in which we are all stakeholders as well, happy to advocate and continue to align.
Awesome. Thank you. And yes, our next conversation is about resources and who to begin including in all these conversations. And I do know that FQHCs and IHNs are on the agenda to start discussing. So thank you all for the comments. Does anybody have any other questions? I just have, okay, sorry. Oh, go ahead.
Can you send us a presentation whenever you get a chance?
I sure can. Yes. I do have one more plug really quick, if I can just move on. Last thing here is regarding our upcoming event. And our last event We did have a wonderful turnout of our December Passport to Community Health event. This was held at the Deaconess Foundation, and we were so excited in collaboration with County Health Department, iHeart STL, and many other community organizations. We hosted this event, and we had 70 plus residents attend. Some of them didn't register as they were coming in. We provided health screenings, utility assistance, direct support, fresh food. And so building on this momentum from our December event, we have organized another one that's going to be at the North County Recreation Complex. And this will be on March 21st. And we're so excited to have another one. Same kind of setup as the last one, since a lot of our attendees said they were looking forward to the next one and they would attend another event. So if you could share, we'll be sure to get this information out to you after the presentation. If you could share with your networks, we'd really appreciate it.
Thank you. And real quick, I received I don't know if anybody else haven't received that yet neither, but the PowerPoint presentations from December.
I'm sorry, what was that?
Kat, I'll get that. Chris,
Okay, thank you.
thanks, Kat.
Yeah.
Chris, yes, we are still working on you mean the impact report. We're still working on finalizing that. That'll be out. It's a little late, but it'll be out in the coming weeks.
Okay, thank you.
Right, that's all I have. Thanks everybody for having me.
Thank you so much, Pat, for that incredible presentation and rich conversation that we were able to have. Thank you all who contributed. I think this is what supporting public health looks like, is starting with, good discussion. Commissioner Anwari, did you have anything else from anybody else from your department that you wanted to have weigh in on the conversation?
No, I think we're okay.
Okay, I see Rhonda has joined us. Did you want to?
Hi.
Hi.
Yeah. I was on the whole time, but sorry, somehow I couldn't be seen or heard. but I got a new link, so it's working now. I just wanted to let you guys know that as part of these conversations that are just now initiating, we would like to involve the FQHCs more in that conversation, and we're planning on reaching out because when we go to do the community health assessment, we want to get that survey out to as many people as we can, and so their assistance with that would be great, and also we are looking at finding some type of data warehouse so that we could collect the data and be able to share the data that we get through our assessments with our partners. So I wanted to let you know that those talks and plans are in the works. How soon we could get a shared data warehouse going, I'm not exactly sure, but that's our goal. And with regards to the chip, we are still in a little bit of a discussion on if we will have one chip or separate chips, because it is going to be very challenging because the hospital systems are dealing with regions outside of St. Louis City and St. Louis County. So they're also dealing with other health departments. So even though the ones in our region will be supportive and part of our chip, they may still have to do chips within their own regions because of that. And we have thought about, talking to some other health departments to bring in more collaboration. But I think right now we want to do like a smaller test phase this time around, and then maybe expand it next time around, just so that everything's running smoothly and we are making progress. So.
That
Thank
was
you.
really super helpful, Rhonda. Thank you. It's true. I know that, correct me if I'm wrong, Mercy and BJC Health Systems have acquired health systems outside of the region.
Mhm.
And so that makes a lot of sense why their priorities may shift, particularly when you think about those rural areas that they have been represented in. Thank you. I love the idea of going deep before expansion. That makes total sense when you're
Yeah.
trying something.
And you got to think about when we get the data coming in for the assessment, these individuals are from different zip codes, some within the region and some without. So our focus is going to be the zip codes in our region, basically. But that data, we want to make sure it's available to the other regions too. Okay, thank you.
A lot of sense. Thank you so much, Rhonda. All right. Are there any more questions for the Department of Health staff or CAT or Commissioner Amrari as it relates to the health department updates?
I don't have anything.
Okay. Then if I'll move on to announcements to the next agenda item. If any board members have any questions that may have been addressed earlier or may not have been addressed, things that they want to announce and discuss before we move to close the meeting for today.
You had a quick question about the quarterly meetings follow-up with the commissioner. Will we able to meet with commissioner yet to see her goals, where her goals were in that alignment?
Yes, they're still working in production. And so they'll be available, I believe. Commissioner Ward, correct me if I'm wrong, next board meeting, the strategic priorities alongside the impact report. I think that's what you're talking about. Is that right, Chris?
Yeah, the goals that we talked about as a Board of Health at the joint meeting, committee meeting in January. So I think that's it.
Mm-hmm.
Okay.
Yeah.
Cool.
So I think it may be next month.
Okay. Awesome. I did want to share another thing as well. I know I shared this with the board. I just want to make us aware that the federal government is holding the health insurance companies, CEOs accountable for like healthcare affordability in general. So I want to drop in the chat here a link to that that hearing. So I definitely encourage everybody to go watch that. It's a very good watch to see what's going on in the healthcare ecosystem when it comes to healthcare affordability. I think it's becoming a crisis, and something is probably going to change in the healthcare ecosystem. So I just want to make us aware of this. No action needed, but I just want to share that with you all. This was in January of 2026, so very recent. And it was a lot of back and forth, and the politicians were like they look like they're in alignment to make a change somewhere because healthcare affordability is kind of out the roof. So yes, I just wanted to share that with us. And I just encourage everybody to continue to watch this and see what may happen.
Thank you so much, Chris, for dropping that in the link, and we'll capture that and share it. I think you also shared it with the board, but we'll make sure that we share it again so people can review that hearing. Brittany, I see your hand up.
Yes, thank you. Yesterday, we had a wonderful Empowered Thriving Communities collaborative meeting. That group is a local grassroots group collaborative with local farmers, growers, kitchens, pantries, food banks. And Craig is also a part of the group as well. We had great conversation and realized that there is a Food is Medicine Act hearing today. It was at 8 a.m. I'm not sure if it's still going or not. But if those who are interested in the Food is Medicine work, I will drop the links of the bills in the chat for us to be able to follow along and see what happens with that. We've ongoing conversation around nutrition and food access, and this is one of the areas that I know many of us on the board and those who are tuning in are interested in following. So I'll put that in the chat.
Thank you so much. Anyone else have announcements? Because I have a few. Okay. My announcements are things that probably you all have heard or know. The Department of Health is still looking to fill some positions. They have been diligent and posted on their social media sites what those positions are. Last we spoke with Commissioner Nwari, I think the top priority positions include the public health nurse positions, which there are 2. So you have the opportunity to share those, and anybody that you think would be a good candidate, to reach out to them. The link to apply is on their social media online. I also can send it in a follow-up email. I believe they're the same as the one from a previous email we sent out before. And I did hear from the mayor's office. There is a formal posting for the director of health position as well. And so their office is asking for all of us to reach out to people that we think would be good candidates and share. If you all do not have the information, please let me know. I'm happy to send that as well. I think those are the 2 things that I have in terms of updates. It's a lot of awesome links in the chat. So if I can have like one person capture them all for the recap summary for the board meeting, that would be great. Are there any other announcements? Anything anyone wants to share? Okay. Well, if all hearts and minds are content, is that what they say in the church? Maybe. If all hearts and minds are content, then we will have our next board meeting March 19th, 2026. Same place, same link. If you're not getting the right links, please let us know so we can get you connected with department staff that can ensure you have your correct panelist Zoom link. Otherwise, I will see you all next month, and this meeting is adjourned.
Thank you.
Thank you so much. Take care.
Have a wonderful
Thank
week.
you.